My relationship with TDR started when I was doing my postdoc, because I have written my first research project, where I had to show that I was able to develop my own ideas. So I've applied for TDR support and I got it. So it has been great. And the TDR support also has been the start in my career on malaria, because I've done my PhD on another topic. So that's really the start of a big story for me. Alors, TDR is a unique organization in global health because it provides support to young fellows, young in science, and give them the opportunity to develop their ideas, to develop their own research group, and to make their own route in science. The impact of TDR in my career has been great, has been important, because thanks to this support, I've been able to develop my own research group and to publish and to write my name as a scientist. And I also have been able to work in Africa with TDR support. So that has been the start of a long story in science.
My first interaction with TDR started more than 10 years ago, when I got a grant to monitor a clinical trial on behalf of WHO, and I got trained as a clinical monitor in Thailand. And then from there, I have had some more interactions and training. I was part of the team that started the implementation research program at the University of Zambia, which also came as part of TDR. So I was part of the faculty at the University of Zambia, teaching epidemiology students how to do implementation science in epidemiology. The support to my professional development has significantly contributed to my career, because I think at the time I got the clinical monitor training, it was just at the beginning of my research career. And what they taught me about how to monitor clinical trials and how to just look at the entire research endeavor has stood with me throughout my career, because it taught me the principles of how to conduct research and how to make sure that whatever you've planned is being done according to the protocol. And it has also taught me a lot about how to interact with colleagues and how to make sure that when we do research, we follow certain principles. And I think it has also taught me about leadership, and how to basically just deal with people. At the moment, my current job, I'm the Director and CEO of the Tropical Diseases Research Center, which is based in Ndola, Zambia. And that institution has a history, a long history with the WHO TDR, because it was created in 1975 with support from TDR. So it was run by TDR from 1975 to about 1982, when the Zambian government took it over. The institution was created out of the need to build the capacity of developing countries to conduct research in neglected tropical diseases. So at the time, most of the research in neglected tropical diseases was being done in European countries, but most of the burden of the disease was in developing countries. So the World Health Organization created regional research centers in developing countries, one of which was Zambia. And so that was the beginning of the institution which I work for now. And so initially the institution started with those neglected tropical diseases like schistosomiasis and malaria. But we have over the years transformed the institution to conduct research in diseases other than those, just in order to move with the times, because the disease burden has changed, and so we have had to change with time.
I started working with TDR since 1990. That's more than 30 years ago. I started as a scientist in their Field Links program, which is a program that links young researchers all over the world. Since then, I've worked in various roles for TDR. I've been in various technical committees of TDR, including the Scientific and Technical Advisory Committee, and more recently as chair of the TDR Global, which is a community of practice of TDR. I think the most unique about TDR is its unwavering commitment to health equity and using health research in order to address the huge burden of diseases of poverty and neglected diseases. It also uses health research capacity building so that developing countries themselves can really lead the health research that they need to address these problems. The other thing about TDR is that although it's half a century old, it has been able to embrace change and innovation. For example, CIDEIM, which stands for Social Innovations for Health Initiative, has been able to promote and do research on the most effective community-based solutions that communities can develop and test. If I look back at the years and my relationship with TDR, it has certainly had a profound impact on my career. It has helped me develop collaborations across the globe, especially help strengthen regional centers of excellence for health research. So I really think that without TDR, I would not be where I am today. Also, because of the emphasis of TDR on implementation research, TDR has helped me gravitate to health policy and systems research to make sure that the health findings and the health research findings and recommendations actually are put to good use, good policies, and actual action.
Eu sou Alda Maria da Cruz, pesquisadora da Fundação Oswaldo Cruz e atualmente diretora do Departamento de Doenças Transmissíveis do Ministério da Saúde do Brasil. O TDR foi muito importante na minha formação e na minha trajetória até aqui. Eu desenvolvi a minha tese de doutorado em imunologia de leishmanioses e por essa razão, pelo fato do meu projeto também ter sido financiado pelo TDR, eu tive a oportunidade de fazer o curso de imunologia aqui em Lausanne e também estagiar junto com o professor Jacques Louis no laboratório do TDR em Lausanne. E toda essa formação, né, foi muito importante para influenciar toda a minha carreira científica.
So for me, my formal training in research started while I am the participant of operational research training conducted by the union, which was supported by TDR. From this training, I gained the skills for conducting operational research, and I participated practically in the field by developing tools, by collecting the data and analyzing those data, as well as publishing the results in the peer-reviewed journal. Apart from this, I was also the student of implementation research master's training, which was in University of Gajah Mada, Indonesia. So here I learned various skills on implementation research training. These trainings made me interested in operational and implementation research, and now I have recently completed PhD in epidemiology with the research focused around implementation research. So I say that for me, the support and scholarship from TDR really helped to achieve my career goal. TDR is helping to train the people on implementation research, where the manpower is being produced so that the people trained in operational research will work in their setting to find the bottlenecks around various tropical diseases. Yes, of course, there are various challenges for conducting implementation research in lower and middle income countries. So this is the speciality of TDR to support and train people in low and middle income countries so that we can fight against tropical diseases in these settings.
Mi relación con TDR inició 10, 12 años atrás, cuando llegué a CIDEIM, que es Centro Regional de Entrenamiento en las Américas, y empecé a recibir entrenamiento en investigación a partir de los cursos que TDR entregaba, y además tuve la oportunidad de empezar esfuerzos para diseminar el fortalecimiento de capacidades en la región. Creo que TDR es especial y única porque le apuesta al fortalecimiento de capacidades en investigación en diferentes niveles, no solo en investigadores, sino además en implementadores y tomadores de decisión. TDR me ha enseñado el valor de la investigación y el valor de la investigación de la implementación para acortar los tiempos entre los resultados de investigación y la implementación, y por supuesto para mejorar de manera más efectiva y rápida la salud de nuestras comunidades.
My relationship with TDR basically began with the WHO TDR clinical Research Development Fellowship. And so I was a TDR fellow in 2016, fully funded by the TDR to do a placement at GlaxoSmithKline in Belgium. I think for me what stands out the most was the fact that its mission at that time was to build capacity, research capacity for scientists, early career scientists who are coming from low and middle income countries. And so for me at the time, as a junior clinical researcher coming from a developing country, I think that was a great opportunity and a great vision for TDR to be supporting us to gain, research skills, capacity by placement in some of these pharmaceutical organizations in the developed world. The impact of the TDR placement has been massive, actually. So I did a one-year placement at GlaxoSmithKline in Belgium, and at that time I was working on the RTSS malaria vaccine in terms of research projects and trials that were happening, looking at its co-administration with other pediatric vaccines. And so from a public health perspective, one, that was my chance to take part and participate in one of the very first malaria vaccines that was available at the time. And then from a career perspective, I went back to my home country. I proceeded to complete my PhD at Keme Wellcome Trust Research Program. And of course, the skills that I gained during the time I was in GSK was very useful in terms of being able to apply, say, protocol design into designing my own protocols, and even in terms of general skills in study conduct that I used also to apply during my data collection and research work that informed my PhD. And in fact, in terms of looking at it in a 360, I am now working for GlaxoSmithKline in Belgium within the vaccines portfolio for the respiratory syncytial vaccine. And I think that would not have been possible if I had not done my placement, if I had not gotten those skills in clinical and vaccine trials research that I did following my sponsorship from TDR at GSK.
Apenas había retornado al país al inicio de los 90 después de mi entrenamiento en Johns Hopkins, recibí una invitación del Dr. Carlos Ponce para liderar una investigación pionera sobre nuevas herramientas para el control de la enfermedad de Chagas en Honduras, financiada a través del TDR. Este fue el inicio de una relación duradera que ha persistido hasta el día de hoy y que me permitió, en los inicios de mi carrera, adentrarme en el mundo de la investigación en enfermedades vectoriales y conectarme con otros investigadores a nivel regional. Definitivamente la capacidad de financiar investigaciones a profesionales jóvenes en el inicio de sus carreras y conectarlos con una red global de investigadores con reconocida trayectoria en el campo de las enfermedades tropicales, permitiendo un intercambio de conocimiento que potencia las habilidades personales y que posibilita una fertilización cruzada del conocimiento. Una contribución importante que lleva a cabo el TDR en las Américas es la formación de profesionales jóvenes para realizar estudios de posgrado en epidemiología con énfasis en ciencias de la implementación a través de la Universidad de Antioquia en Medellín, Colombia, y que me ha permitido asesorar a 3 profesionales del área de la microbiología en la aplicación de sus postulaciones. Una de ellas ya finalizó y está trabajando con The Global Health Network, y 2 actualmente están finalizando su primer año de maestría. Esta es una oportunidad única para profesionales de países de bajos ingresos para desarrollar sus estudios de maestría fuera del país. Bueno, el TDR fue instrumental al obtener 2 subvenciones de del programa de pequeños subsidios que fueron pioneras en Honduras y en la región centroamericana. A través de estas investigaciones establecí una red de contactos profesionales que me permitieron crecer profesionalmente, pero además a ser reconocido a nivel del país como un investigador en el campo de las enfermedades vectoriales, con varias publicaciones a nivel nacional e internacional. Asimismo, me permitió estar informado de los avances realizados por otros núcleos de investigadores en el continente y compartir los resultados de mis investigaciones. Recuerdo con mucha satisfacción haber sido invitado por el grupo de investigación del profesor Betanzos Reyes del Instituto Nacional de Salud Pública para colaborar en la revisión de un manual dirigido a escolares para el control de la arbovirosis y finalmente en el año 2021 fui seleccionado como uno de los finalistas del concurso de carrera de impacto global.
We started working in infectious diseases of poverty in 1988, and I'd been in the job about 8 months. I went to Geneva for a committee on issues relating to the program of TDR. So that was in October 1988, and then soon after I was appointed to a social and economic committee of the organisation, and the aim of that committee was to support and encourage research on social aspects of infectious disease. That was 1988, and I have continued to work with TDR since then, almost continually, primarily on advisory and expert committees. I think what stands out for me is the emphasis on diseases of poverty. And I remember many years ago, probably in the early 90s or late 80s, talking about diseases at the end of the road, the people who live at the end of the road, if you can think of that as a metaphor. And I think that it really drew attention to me, the way in which particular disease took advantage of, exploited people in impoverished conditions and spread under those same kinds of conditions. So in a way, it was an extremely radical program because it insisted that people looking at the social determinants of infection and the social consequences of those infections took a perspective that was essentially class-related and took account seriously of the way in which globalization exploits people's everyday conditions, which in turn impacts on their health. When I was in my mid-30s, I joined a program that was just being initiated focusing on tropical health, which is, I guess, one thing, and at that time to talk about infectious diseases of poverty. I had only been there briefly when I was invited to go to Geneva for a specialist committee on social, economic and behavioural aspects of tropical disease. That got me thinking about diseases that I didn't know much about and put me on a very steep learning curve in relation to the virology, the epidemiology, the pathologies of different conditions that are most predominant in very poor populations. And the following year, I was appointed to the Social, Economic and Behavioural Research Committee. Thereafter, I was involved in governance committees across the whole TDR portfolio, so in terms of epidemiology and research strengthening and different iterations of supporting social and economic research. And TDR has really shaped
how I think about diseases and then translate it from infectious diseases to other diseases and to address the complexity.
My relationship with TDR begins with my first appointment as a research assistant under the TDR small grant supported for filariasis disease. So I got my first postgraduate degree, MPhil degree in molecular biology from that research grant, and then I completed my PhD just because of the TDR supported postgraduate research grants awarded for me as a principal investigator, and I completed my PhD in 2018 from that TDR grant support. So after that also I have received 2 TDR small grants for leishmaniasis research. Further, I'm thrilled to tell you that I have been selected as a finalist in the TDR Global Career Impact Contest and TDR 50th anniversary photo contest. So my relationship with TDR is really strong. TDR is a unique global health organization because it helps me to develop my professional life smarter than I expected. So it helps me to strengthen both my academic and research qualifications from a very basic level, because when I joined as a research assistant of the TDR supported grant, I just had my bachelor's degree specializing in agriculture biotechnology with 6-month research experience. So but TDR helps me to master in vector-borne disease control research and uplift my research career as a senior academics and academic advisor for postgraduate students. I highlighted earlier in my career life is blessed with the best of the TDR. So working on 4 TDR supported research grants, winning 3 TDR research grant as a principal investigator, and 2 finalist awards from 2 different TDR contexts. These are the turning points in my life. So, and TDR made me a strong scientist in the field of vector-borne disease control research in Sri Lanka. Further, a massive open online courses on implemented research conducted by the TDR helped me to strengthen my research career from the proposal raising stage to implementational level and even beyond that. So I think the most important thing, I have been identified as a prominent scientist among the very few female scientists who are working in vector-borne disease control research in Sri Lanka just because of the TDR capacity strengthening support. So I don't have words to thank TDR. Thank you TDR for supporting female scientists like us to emerge.
TDR technical support in my groundbreaking research on onchocercal skin lesions, that is skin rashes, unrelenting rashes caused by river blindness. This provided the scientific basis for the creation of the World Health Organization African Program for River Blindness Control in Sub-Saharan Africa, and TDR support to me continuously even after that. My first encounter with TDR led to the groundbreaking research on river blindness control. Investment in capacity building of scientists and researchers all over the world for decades. Uninterrupted support to universities and institutions. Development of unique, very important programs for the control of many tropical diseases. Support to women to make sure that no one is left behind in building capacities of scientists in my sub-region. TDR has given special attention to African women, African scientists, female scientists, and I know a number of them that benefited and went ahead to become stars in science. Beaming the light for me, or let me put it this way, sponsorship guidance in developing my capability to showcase the findings which provided the scientific basis for the creation of APOC. If TDR had not done that, I am not sure there will be APOC, that the donors would have expanded the control of river blindness in sub-Saharan Africa from 11 countries where they were before my studies to 30 countries. That expansion may not have happened, but for the work and the encouragement of TDR and the guidance, the technical guidance I received from TDR for over a decade.